Now, Rochelle Walensky is an actual doctor. She went to Harvard. She's the director, in fact, of the CDC. She's never been elected to anything, but since this is a pandemic, Rochelle Walensky's word is law. It's more powerful than anything the Congress produces. She's her own federal agency. In fact, she sits between king and God somewhere there on the continuum. So listen carefully as Rochelle Walensky tells you that COVID is killing twice as many children as influenza does. Watch.
I think it's really important for people to understand that this is not a benign disease in kids compared to other diseases that our kids see. So if you look at the mortality rate of COVID just this past year for children, it's more than twice the mortality rate that we see in influenza in a given year.
So you're not supposed to question that, and we didn't really dare to check those numbers because who are we to check the numbers from an unelected federal bureaucrat when she's commanding us to obey? So we didn't. We just took it at face value. But a guy called Phil Kerpen, who's a columnist and good at math, had some free time, and he decided to check the CDC numbers on what the CDC director just claimed on CNN. And what did he find? He found that the director of the CDC has no idea what she's talking about. So here are the actual numbers from the CDC website. From 2019 to 2020, according to the CDC, a total of 124 children died of COVID. From 2020 to this year, which is not done yet, a total of 213 children died of COVID. Now, by comparison, the influenza virus killed more than 400 children just last year. And in fact, that was not an aberration. Influenza has killed far more children than COVID has in each of the past 5 years. In fact, it's not even close. And all of that is assuming that the CDC's numbers on underage deaths from COVID are accurate. And it looks like they're not. In a recent report, the CDC itself acknowledges it could be vastly overreporting the number of children who have died from COVID. The CDC report says that when considering everyone who died of COVID, roughly 2.5% of those who died had a coexisting medical condition unrelated to their deaths. But for children under the age of 18, that number went up dramatically. It was over 35%. Over 35% of children who died from COVID had what the CDC called a, quote, unrelated medical condition. In other words, more than a third of children who were listed on the official records as dying from COVID had a comorbidity that the CDC assures us cannot possibly be related to COVID. But it appears, upon closer examination, that the comorbidities might in fact be related to the deaths of those children. Now, we're going to pause here and say, why are we getting so precise about these numbers? Because these numbers are being used to justify putting a mask on your third grader for an entire freaking year at school. What's the effect on a child of doing that? Of sitting in a classroom full of people whose faces he can't see? Of breathing cotton fiber for 10 hours a day, every day? They're profound. So these numbers matter. So for every other age group, these sorts of comorbidities are much rarer, and that makes sense when you consider that COVID is much less dangerous for children. Now, Joseph Allen is a scientist who works in the Lancet's COVID committee. He found that, quote, 3 major studies over the past year all found the risk of death to be in the range of 1 in 100,000 to 1 in 1 million. Hospitalization rates for school-aged children younger than 12, the group that can't get vaccinated yet, hovered around 3 or 4 per million throughout the pandemic. If you need perspective, those are extremely low numbers, much lower than the CDC director just claimed. Dr. Marty Makary, who works at Johns Hopkins, found a, quote, mortality rate of 0 among children without a pre-existing medical condition such as leukemia. So in the face of those numbers, which they are lying about, based on their own reporting, this is apples to apples. The director of the CDC just lied about what the numbers are that her own organization produces. But based on those numbers, they're saying that kids should be forced to wear masks and take the COVID vaccine. Clearly, there's no science to back that up. But Rochelle Walensky does not care. She is instead full force leading the charge for more mandates for children and adults. In fact, according to Rochelle Walensky, we need vaccine passports to make certain that people who haven't gotten the shot can't leave their homes or make a living.
I know they're doing it in Europe, but you're not CDC director of Europe, which I'm sure you're plenty happy about. But they're issuing health passes there, right, where, you can go to a disco, or a discotheque, as they like to call it there, if you have a health pass. Is that something that the CDC would ever lean into or perhaps advise here?
You know, I think some communities are doing that, and that may very well be a path forward.
If I said it, I meant it. Bite my tongue for